Healing Horizons, where each week we share the latest news and research in trauma-informed care, positive and adverse childhood experiences, and psychological safety. I'm Alison Cebulla.
And I'm Twombly. I use she, her pronouns. And 10 Collective is creating a world where we genuinely care for one another. We want you to consider hiring us here at 10 to implement trauma-informed care and psychological safety-based programs, policies to help with grant writing, lit reviews, any kind of needs that you have related to the trauma-informed and psychological safety kind of world. To ultimately help you to better care for your employees and in turn for the kind of communities and children and families that you're serving. You can find out more about us on our LinkedIn page and our website, which is 10-collective.com.
And before we get started on this week's news, we want to invite you in 2 hours. We have a really amazing conversation discussion on Zoom with Dr. Darsha Narvaez about her book, Restoring the Kinship Worldview. And Bree and I both read this book, and it was such a moving book. It really encompasses everything we're trying to create here at Tend, which is a world that's more relational, where we care about how our actions make other people feel. And that was our inspiration for founding Tend Collective, was just noticing that we kept being in work environments that didn't seem to care about how employees felt. Even if those organizations were out there making a difference in communities, there seemed to be a lack of care for employees internally. And this is so much a part of greater systems and cultures. And so this book looks at Indigenous precepts from all over the world, Indigenous groups all over the world, and really curates the very best ideas for how to build a world that they already had before colonialism, that really puts humans among all living things rather than the highest one on the pyramid, and one that we care about fellow humans and all living beings and what we may consider to be inanimate beings. And it's a really, really, really beautiful book. So I hope you can join us for that conversation tonight in a couple of, it's not tonight for me. Could be morning or afternoon, depending on what time zone you're in.
You also, you don't have to have read the book to come. So don't let that be a barrier for you to be like, ooh, I don't know. It's still going to be a great event and very accessible, even if you haven't read the book yet.
Thank you for saying that, Bree. Yeah, it's going to be very, very accessible for everyone. So please join us. So news today, and today we're going to keep it a little shorter than usual, just to prep for this next upcoming event that we hope you'll join us for, but still a ton of great news to share with you all. So let's jump in. Today is May 16th, 2024, and a content advisory. We will be talking about trauma, which sometimes means that we're talking about violence. So first piece, this was an article that came out on May 10th in Barbados. Child Care Board to host trauma-informed care workshop. Now, we love hearing about international news. We love knowing that this is a movement that's happening all over the world. So really love to see this one. The Child Care Board, in collaboration with the Barbados Public Workers Cooperation Credit Union Limited, will host a trauma-informed care workshop for all public primary and secondary school guidance counselors to aid them in their efforts with students. And the topics covered: what is trauma, trauma in the brain, trauma triggers and re-traumatization with the schools, experiencing trauma in the educational setting, and psychological interventions for trauma management. And I love that list of topics. I was just immediately impressed. I was like, yep, that is the exact curriculum that we would design here at 10 Collective and what we would recommend. And we love to see brain science included when we're talking about trauma. And also the audience for this workshop being school guidance counselors is absolutely the right audience. So these are people who are offering support and emotional support to children. So this is a really good audience for these teachings. So
Yeah.
that's
The other, ooh, sorry, Allison. I was just gonna say the other topic that I really love is the experiencing trauma in the educational setting. And we've talked about this a few times over the past few weeks, but like adults and children can experience trauma at school within that educational
Mm,
setting. There's still lots of practices, systems, just bullying, experiencing harassment, microaggressions that are happening where kids are experiencing that. And as adults, us too. So I love that they're having conversations about that and addressing it instead of that kind of being the like possible elephant in the room.
completely. Thank you for saying that. Absolutely. Okay, new integrated crisis center set to open this summer in Kitchener, um, in Canada. So, another great piece of international news. A new integrated crisis center will open its doors this summer in Kitchener, acting as an alternative destination to hospitals for people with mental health or substance use crises. Thresholds, Homes, and Supports and Canadian Mental Health Association Waterloo Wellington are working together to make it happen. Officials said this would be Waterloo Region's first integrated crisis center. Um, Honestly, I love it so much. I'm like, yeah, I'm just, that's so, we need these. We need these. I'm like, yes, it's your first one. Do it. Um, the ICC will ensure clients have a welcoming environment designed specifically for mental health, addictions, and crisis challenges, with access to crisis stabilization and services, including peer support that will improve their overall support experience and health outcomes. So, yeah, I don't know if I hear about crisis stabilization enough. And it's possible it's not on my radar, but seeing this really felt good because I have gotten to know a lot of people over the years with substance use disorders and severe mental health issues. And I just noticed in the US, in California, that there were not crisis centers to help people weather a crisis. And the thing is, when you understand the science of trauma, you understand that crisis mode um, could be a way of defining our brain when we're in fight or flight, or as they say, our lid is flipped, or amygdala hijack. You know, all of these ways of looking at it that are, of course, sometimes criticized for being oversimplified, but help us understand that there are times when our brain is not going to be able to make rational decisions or make the best decision for ourselves. There's no access to the parts of the brain that are responsible for executive functioning. And executive functioning is really just, can you do something that you want to do? Like, are you able to do it? And if you're in a crisis or if you are coming down off of substances, it's just not possible. And I would love to see more centers like this where it's like, let's help this person regulate first, get access to their whole brain, see if we can help them regulate the amygdala, the fear response, and then come up with a plan moving forward. So I hope that's what this center is doing. It seems like it is, and I'd love to see more of it happen.
Yeah, and I'm just thinking from um like working in mental health and knowing, especially for like adolescents, if adolescents were having mental health crises, often they would end up in the emergency room.
Mm.
And there weren't enough like beds or spaces open within kind of psychiatric hospitals or other kind of like treatment centers for inpatient. And so they could end up in the emergency room for weeks and weeks, not getting the services that they needed and kind of remaining in that crisis mode. So
Because
yeah,
emergency department is a crisis mode. I
yep.
was just in the emergency room for I broke a couple of ribs in August, and they wanted to keep me in there a pretty long time because I had punctured a lung when my ribs broke. So it was serious. They didn't want my lung to collapse. But I told them, I was like, there's no possible way that I can recover, that my body can recover in
Mhm.
this environment where you have every overhead light on and everything beeping and buzzing and
Yep.
people freaking out next to me and physicians yelling across the room. I was like, how can people recover in this? Yeah.
Yeah.
So they let me go. But you're reminding me that my experience with the friends that I have supported over the years in California is that the place where people end up who are in crisis is jail.
Mhm. Yep.
And that's just awful. And we can do better and we should do better.
Yep. Absolutely. Yeah. The next one that we are highlighting this week is out of North Carolina. And this one is called Trillium to Launch Healthy Opportunities Pilot Program. And Trillium Health Resources is based in North Carolina, and they are launching the Healthy Opportunities Pilot Program in 15 North Carolina counties beginning yesterday. So, what they're doing with this pilot is they are taking kind of like a set of non medical evidence based services for high risk health plan members. So, some of the services address things like housing, interpersonal safety, food, transportation, to help to improve the health and well being of members. It's going to leverage findings to help to integrate interventions that improve health outcomes into the North Carolina Medicaid program, kind of statewide. The pilot services are only available to certain health plan members. So it's Medicaid managed care members. They have to live in one of the identified counties and meet at least one behavioral physical health criteria and at least one social risk factor. So you can see those when you kind of go to the link of how they've defined those as far as criteria. But one of the things that I did want to kind of recognize is one of the behavioral physical health criteria is children 0 to 20 experiencing 3 or more ACEs. And so kind of nice to see thinking about trauma and the impact and what that could mean for accessing services for people. So some of the things that I talked about was like housing safety inspections, advocacy for survivors of violence, bus passes. So really just trying to remove a lot of those barriers that exist for people as they're trying to access services, support, or basic needs. So it was talking about like getting to childcare, being able to
Yeah.
go grocery shopping, just all of those things. So I found this really interesting as kind of a pilot. I'm interested to see how it works, what they kind of find from it, and also hoping that if it is successful, it can be expanded to be more preventative instead of having this like you have to meet these different levels of criteria in order to participate within this program. But
Well,
I
and
get it's a pilot; they're starting somewhere.
yeah, totally. You and I talk about this a lot, here and also offline of um, the fact that all of these different state programs that support people in need have different criteria. And every single time you have to talk to a different person and tell your story over again. And this is proven to be one of the best ways to reduce trauma and re-traumatization in populations that are marginalized and in need is to sync up all of these different systems so that people do not have to share their story and do not have to jump through as many
Mhm.
hoops that are so each one has a different requirement.
Yep.
um, and the individual stories, when people share their individual stories of trying, they're already struggling, and then I just lost my snap because I got 2 more hours at work. Oh, but I did get qualified for this other thing, but then it couldn't come through because it's not a way to treat people.
No, there's a lot of requirements that aren't super supportive. Again, when we're thinking about being able to care for and like help people and create um, healing communities, there's a lot of that isn't there. And yeah, having to go in, answer the same questions over and over again, tell your stories of trauma, tell all of the stress that's happening in your life to people that you may see one time and just over and over again. Like that's not a model that we want to be. kind of functioning for people. It's not relational. It's not treating people as human beings. It's doing a bunch of like check boxes to see if they are worthy or not
Yeah.
for services. And what
Yeah.
does worthy or not mean? Who determined that? So many questions.
Don't even get me started.
Nope.
So this
Nope.
is what we're thinking about when we see interventions like
Yep.
this. How can we integrate them more to streamline the process and humanize
Yes.
people? Yeah.
Yes. Absolutely. So then this one is interesting. It's the Jacob School, which is out of the University of Buffalo. It's their medical school. And their medical students have developed a course to train their peers in trauma-informed care. So actual students who were kind of in there in the program, creating a program for their fellow students. So some of the students worked with community anti-violence groups in Buffalo, and they developed an elective that they call trauma surgery and trauma-informed care. And really the purpose is to help to train medical students, particularly those who are interested in surgery, in trauma-informed care within Buffalo's Level 1 Adult Trauma Center at the Erie County Medical Center. So they partnered with two anti-violence organizations, Buffalo Snug, which is Should Never Use Guns, and Buffalo Rising Against Violence, or BRAVE, their trauma recovery center. And the students really are serving as navigators for trauma patients and their families, offering support and advocacy during their hospital stay, clinical follow-ups, and home visits. So again, it's building that relationship and
Mhm.
having that kind of consistent person to talk to check in, to really understand what's going on, to recognize some of the reactions that the family and the individual could be having based on this. And this idea came from three students who had been awarded the Summer Diversity Research Fellowship. And this was really because there had been an increase in shootings, as well as the mass shooting at Tops Market in Buffalo. So recognizing the gun violence and the impact on the community. So they started working by connecting with community organizers, pastors, local leaders, neighborhood residents, to really listen to them, to understand what their experiences had been like as victims of gun violence. So what had been done, what questions were asked, how were they treated? So right, getting into centering the voices of those who had experienced that. And then I wanted to share this quote from Sydney Johnson, who was one of the students who developed the program. She said, "As the surgeon, the only time you see the patient is in the OR. You need a bit more humanity. When you understand the world the patient comes from, the injury that brought them to the hospital, and what they are going home to, you can be more proactive in their care. When you, the provider, are able to take all of this into consideration, the patient will have better outcomes." And so I love that. And there's probably, right, like as a surgeon, there's probably this like level of detachment that's good for you
Yeah,
to do your job
right.
and do it. But also there's maybe other things that you're not thinking about, or like becoming too detached isn't great. You could say comments that you normally wouldn't say to people. So helping people to remember this is a human, they've had these experiences, this is what could be going on for them or their family in this moment is really important. And again, just that community-based participatory research kind of model that they used for creating this program, I really liked.
Love to see that every time. Yeah,
Mhm.
really good. Um, so one thing that happened in the past week is that Governor Gavin Newsom from California proclaimed that Adverse Childhood Experiences Awareness Day was now be May 11th. So um, this is already what
Mental health awareness or acceptance, depending on who's kind of doing it.
Yeah, I try to not roll my eyes about the different days and months of things because oftentimes advocacy groups worked really hard to get these in place to gain awareness. But I always worry that they'll be used as a marketing gimmick to sell things or um and when it comes to like mental health month, um there's a lot of posts on LinkedIn that really make me cringe that really feel like people are taking advantage of this as a content opportunity. Um, But all of that being said, I am continually impressed by California leading the way in taking adverse childhood experiences seriously and making them a priority. And so this is going to be, I'll be curious to see how this plays out in the future. But of course, giving something an official day means it's going to be acknowledged from here on out. We're not going to ignore it. It's now permanently on the calendar. So that's exciting.
Mhm.
Yeah. What are your thoughts on special days for things?
I I think it depends. I think like right at the heart of like especially Children's Mental Health Awareness like day and month is like recognizing that it's there, it exists.
Yeah,
Trying to remove a lot of the stigma that we have,
right.
especially in America related to mental health for everyone, but especially for children, and saying like we all have mental health. Sometimes we're in this area of the continuum, sometimes we're over here. It's okay to ask for help. These are things that we can do. This is how you can support your mental health. So I think it's good for just like recognizing and like appreciating it. I do think, like you're saying, there are times that individuals or businesses then say, oh, this is happening. How can we profit from this?
Yeah.
Missing really what the goal is. Like instead of making merchandise with a slogan on it
Right.
about the month, like how are you investing in that? Like, what actions are you taking for advocacy, toward giving money toward local behavioral health clinics, toward like those who are like on the ground doing the work for this? I think that that's often missed, which
Yes.
would be more of the purpose, I think, of those days if I was a business.
Right, right. And this comes back to what we were saying at the beginning in terms of trying to create together a society that's more relational. And so I think that these days would not bother me so much if I was seeing that happen, on
Mhm.
social media, that the posts were like, "Oh wow, this is the spirit of this day or this month." And I'm not yeah, what I'm seeing a lot of is people trying to capitalize
Mhm.
rather than bring us closer together. And that could be the nature of this could be a really big philosophical. This could be the nature of social media. Another time. Yeah.
Whole other conversation.
Yeah. Yeah, we should do a webinar. We need to keep a running thing of webinar ideas we come up with during Healing Horizons. Yeah. So, this next story does involve violence, heads up. Convicted murderer Thomas Vargas reflects on tragic past, how adverse childhood experiences shaped his life. And so this came out yesterday, May 15th, 2024, on Fox 26 Houston. Um, I really love seeing these types of articles come out. Honestly, this would have been unheard of 5 years ago, 10 years ago.
Yeah.
15 years ago, 20 years ago, you just weren't seeing this. How can we talk about someone's childhood in relationship to the violence they may be perpetrating? Um, and it's such an important conversation to have. We had a piece about this last week or the week before, just showing that trauma informed interventions for perpetrators of violence really work. They
Mhm.
really work to stop violence, just stop the violence. And so this is such an encouraging area to focus on if you're wondering if trauma informed interventions work. In this area, they do. And
Mhm.
so this is a convicted murderer. He was doing a robbery that then he said someone the reporter said, "Do you remember the time in your mind when it went from a robbery to stabbing someone?" And he replied, "No, I just remember panicking." And so, again, it's so important to understand brain science and to understand what's happening when someone's already in an elevated state in their brain and something goes wrong. Then we do get panic and the potential for even more violence. So, it's good to note that. So, um, this article says that the CDC says having a high ACEs score can lead to a multitude of issues, from physical health to, this is funny, it can lead to socioeconomic struggles. That's what the article says. Strike that, reverse it. Yeah. So they're not getting it 100% right, but they're trying. We love them for that. So the Center for Child Counseling says 90% of young people in the juvenile justice system have at least one of these ACE stressors, and usually far more. So, Vargas was exposed to multiple childhood stressors, but said he didn't experience any firsthand abuse. He says what he believes was the turning point for him was the lack of family involvement in his young life. And he says, I sat there in the middle of the basketball court after this game and watched all the kids run to their families, and I was alone. That was the turning point for me. And I want to highlight how much a lot of the other literature on trauma affirms this, that neglect is often the thing that can turn someone into having more psychopathy or sociopathy. And if you're interested in learning more about this, I highly recommend the book, The Boy Who Was Raised as a Dog by Dr. Bruce Perry. This was the book that really answered a lot of my questions about how could someone turn into a murderer? What's happening in their brain? Like, what's going on? And the answer is pretty extreme neglect. So the fact that this man is saying, yeah, I did murder someone and I really think it was neglect is like really affirming what a lot of the other literature is saying as well, because our brains are wired to constantly ping other people. We're just interacting with people all the time and we're sending little pings off and then we're receiving them back. And so neglect is really the worst thing that can happen to a human being. And some people even say even getting negative pings for attention are better than none at all. And so obviously we want to highlight how important it is to have positive childhood experiences. So if this young man had even, one mentor come into his life and care about him, this probably would have been prevented. And so that's really unfortunate. But yeah, we need interaction with other people, preferably positive interaction. And as children, because I think he was a teenager when this happened. We need people who are excited that we're alive and are happy to see us and who believe in us and want the best for us. It's just so, so, so important for proper brain development.
Yeah, I'm thinking too of like a teenager, and right, like you talked earlier about our executive function part of our brain, and that still is not fully developed as a teenager. It's not
Yeah.
like fully developed until like our late 20s, early 30s.
Yeah.
And so that makes it hard to have impulse control,
Yes.
to be
Yes.
able to plan, to be like, oh no, like I'm in this situation now, like what do I do? And we're just in full survival brain
Yep.
at that point, and not making the decisions that have the best long-term
Definitely
impact.
not. Yeah, teenagers are terrible at making long-term
Mhm.
decisions, which is why
Yep.
we shouldn't let them take out student loans. But again, another topic. Okay. So, next piece. California adults with adverse childhood experiences, ACEs, are at greater risk for serious psychological distress, and report perceived and unmet need for mental health care services. So, we're going to link to this in the notes for this episode on our website. It's a whole report. Definitely take a look at this report. It's a policy brief. It came out by UCLA, people who work in policy at UCLA, and it's very extensive, and it outlines the prevalence of ACEs in California and that there are still many gaps for people with ACEs in receiving the mental health care that they need. I feel a little disappointed with this report because much like a lot of the interventions that we talk about, it really focuses on treatment and not prevention. And that feels surprising to me coming out of a big think tank like UCLA, that we probably want to talk about how we can prevent ACEs, that the state has a role in preventing ACEs. And the wealth and income disparities in California are some of the worst in the whole United States. You have the richest and the poorest people. And poverty is something that is known to be directly tied to a high ACEs score. And so, absolutely, the state has a responsibility in preventing. And actually, the state of California I think they did put out a report saying that ACEs are costing like, some outrageous $1 billion sum.
Yeah.
So they know that prevention is going to save the state money. So, of course, it's important to connect people who already have ACEs with treatment that they need. We would love to see that. But the conversation, it absolutely must include the state's responsibility to prevent ACEs.
Yeah, we've talked a lot about like systems and systems, the systems that are in place being the actual root cause of the trauma. If those systems look different and there wasn't as much stress and trauma happening for people, it would reduce kind of that intergenerational trauma. So yeah, kind of taking a look at what's our role in it and how can we be preventative for sure. This next one really connects nicely to what Alison was talking about with looking at like why do people end up having kind of behaviors and what does kind of childhood maltreatment, neglect, like what is that kind of impact? So this was in the May 2024 Journal of Pediatrics. And what the researchers were looking at is does abuse and neglect cause behavior problems among children, or do behavior problems among children cause abuse and neglect? So wondering if it went kind of one way or the other.
Okay.
And so what the study found, and this was researchers from Penn State College of Health and Human Development, they confirmed that abuse and neglect cause behavior problems among children much more often than behavior problems causing abuse and neglect. So they used data from the longitudinal studies of child abuse and neglect, which was collected every 2 years from when children were 4 until they turned 18. And they used 7 different waves of data. There's 1,354 children, and there are caregivers between the ages of 4 and 16. And they looked at when the child had a documented experience of maltreatment. And then they examined the relationship between maltreatment exposure and externalizing and internalizing behaviors. And so the research showed that abuse and neglect during childhood led to both problematic internalizing behaviors. So those are things like depression, anxiety, and then externalizing behaviors. So things like delinquency, noncompliance with parents. They found that at the majority of kind of those like waves or kind of checkpoints throughout childhood and adolescence, children who had experienced maltreatment displayed an otherwise unexplained increase in behavior problems during the next wave of data collection. So it really seemed like there wasn't another factor that kind of led to that behavioral change besides the kind of abuse or neglect that they experienced. And then they found that children were generally not more likely to be maltreated if they displayed increases in problem behaviors. They did find one exception to this, and that was that children who displayed increases in externalizing behaviors at age 10, so again, things like noncompliance, delinquency, were more likely to experience maltreatment 2 years later. And so it was really that period. And that period from 10 to 12 is a really critical developmental period for children. You're really going from like childhood into adolescence. At that point, that's when kids are starting to become a little more independent. They're really focused on peer relationships. And so you may start saying or doing things that you weren't before because you're trying to fit in with your peers.
Right.
So like you could have things like you start skipping school with friends. So you have that delinquency, that behavior. And then the result of that could be that parents might end up using physical punishment. Like, right, you're having to maybe as a parent switch to different types of punishment, or like it seems like there's bigger behaviors. How do I respond to those? So just thinking about what's going on kind of in the brain for kids at kind of that part. And again, like really just showing like early intervention and support for positive experiences in parenting to try to help prevent like future abuse. So if you're recognizing that there are some externalizing behaviors, thinking about what are some things to maybe be done to kind of increase those positive experiences for the kiddos.
Great.
So that was just interesting, connected with the one that you shared as well of kind of that experience and then how that can lead to behaviors, right? Because it's changing what's going on in our brains, it's changing
Yes.
how we're wired, it's changing, excuse me, all of those things. So
But
just
then I like how this one is, because I think like since Freud, right? Children have been blamed. Well, if you weren't such a bad kid, or oh, children have these latent desires. They're actually out to get you, or like, oh, your children are born with sin. So it's kind of wild to ask the question, well, does the behavior cause the abuse? But in so many ways, our culture is still there. And that
yep,
question actually must be proven. Like
yep,
these types of studies are needed to say, no, that's not how it works. If your
hmm
child grows up in a nurturing, warm environment, they're not going to have the behavior issues.
hmm hmm yep. And right there's because you're learning skills, you're learning how to be in healthy relationships, you're learning things around impulse control, how to control and express your emotions. And like, right, like this is not saying that like your child will not ever have a behavior because all children are going to, like that's
Mhm,
part of
mhm.
different developmental
Right.
periods. It's part of just like learning about things. So like that stuff is still going to exist, but kind of those really kind of like big, either internal or external kind of like behaviors or kind of like moods can be prevented to a large scale, which we know that too with like the ACEs data, talking about if we got rid of ACEs, we would reduce like all kinds of cases of depression and
Ev-
anxiety and
Everything.
all kinds of things.
Heart disease.
Yep, yep,
Yeah.
yep. We wouldn't get rid of all of it because it's not only ACEs, but we could get rid of a large percentage of it. So,
Could be all aces.
yep.
Could be.
Important to think about. Our last study for this week related to kind of pieces is there's a study that found that almost 75% of the nursing home workforce was under immediate to high levels of stress. And so they found that that was 73% of the nursing home workforce was facing kind of that level of stress, which is a rate that is double that of the general population, which is 34%. Um,
Wow.
yeah.
Wow.
So, really, really high. So this was the Digital Labor Marketplace Care, along with the National Association of Healthcare Assistants. And this is actually a three-part study that they did. They just released part one, that's trying to focus on the impact of trauma on frontline senior and post-acute care staff. Um, they did this study in January. It included kind of insight from 1,142 workers in long term care. 60% of respondents identified as Black or African American, and 95.1% identified as women. Just kind of keeping that in mind as
Yeah.
you're thinking
Yeah.
about and interpreting. So, this first part that they just released is examining ACEs and their influence on today's nursing home workforce. Part two will focus on the role of mental health and personal well being. Then, part three is going to look at social determinants of health and how they shape the future of caregiving. So, they found that registered nurses or RNs had the highest average ACEs score at 3.2 compared to 2.7 on average. And that adverse childhood experiences in the pandemic heightened rates of burnout and turnover among frontline staff, which is contributing to kind of this labor shortage that's going on. One of the kind of senior vice presidents who works at CARE, the organization that was kind of helping with this report, said CARE's study tackles frontline workers' trauma in absent but crucial industry conversation. With 34% experiencing high toxic stress, the study emphasizes the urgent need to evaluate mental health benefits of our care force. So just having conversations around, have people experienced trauma in our workplace? Yep. Like we know there's a high prevalence of trauma in general in the population. There's a high prevalence within the kind of nursing field. So what does that mean when we're thinking about our culture? Do people feel like they have autonomy? Do they feel like they have flexibility? Do they feel like there's safety there? So really with this one, just thinking about like this is again one of those reasons why trauma-informed workplaces are really important. So people have a sense of psychological safety. They feel like they can make decisions. They feel like their voice is heard. They feel empowered. There's access to mental health services when they need them, because they're already coming into a stressful work environment, having experienced stresses themselves. So making sure that there's support.
Yeah, absolutely. Wow, such an important one. Yeah.
Okay, so then psychological safety. So this one was interesting because this was in the law field. So this article was called "Trigger Warnings for Excessive Workloads, Not the Answer," and this was based out of England, and they were talking about using trigger warnings. So if that meant that a lawyer was going to have to work a lot of hours on something, there would be kind of a trigger warning for them.
Okay.
Related to
Okay.
that. Which I was kind of like, I feel like you're missing
Yeah.
the point of, a trigger warning. So this article was talking about like, okay, like that's kind of a reaction to this. Let's think about prevention instead. Like, why has it become normal and expected that like this is going to be what a lawyer needs to do, to the point where we need to think about like having a warning about that they would like need to do that. So it talked about having like policies and procedures for managing health and safety risks within the organizations instead. Cultivating a workplace culture that prioritizes psychological health. So doing things like monitoring like workload levels, ensuring tasks align with employee skills and capabilities. So doing those things first instead of just saying, oh, like this is just how it is. This is how it's always been. So like, here's your warning that this may take a long time for you to kind of complete. And so they really talked about like in the legal profession, starting to think about like, what does equitable treatment look like? What does a supportive environment look like? How are we taking a holistic approach to well-being of everyone who's involved in that? So I liked that they were thinking about this within the law field, which is in a field that there's often like a lot of talk related to kind of trauma-informed care or kind of these like more prevention things, and that they were really focusing on like, let's not be reactionary, like let's step back and like what are those things that we can do to create a better culture and be preventative of this instead.
Great. So this is a really weird one. So get ready. How the sex recession is affecting workplace leadership. So this came out in Forbes on May 3rd, and it's unusual. It's an unusual piece to frame things this way, but we thought it was worth addressing. So this recession, a significant decline in sexual activity among adults, particularly young adults, carries implications far beyond the bedroom. It influences general well-being, social dynamics, and yes, even workplace performance and leadership. Normally, we just wouldn't associate these things, but the surge of endorphins and other happiness-inducing hormones related to sexual activity, such as dopamine and oxytocin, play a pivotal role in shaping leadership mindsets. Leaders who experience higher levels of these hormones tend to demonstrate more empathy, patience, and creativity in their roles. These emotional and psychological boosts can enhance decision-making and foster innovation and collaboration. This also makes me think of how when they study violence in populations that are like mostly male, like I'm thinking about like Wild West of the United States, that when you add women, things get less violent.
Mhm.
And that's pretty well known and studied. So I'm kind of curious about the role of this. Um, and that the extra piece of news that within the last week being the really failed Bumble ads that they put on billboards. Did you see this, Brie?
No.
Okay, in LA, saying that celibacy is not the answer. Because a lot of women are choosing celibacy because of the prevalence of male violence, and it's become a protest. And so Bumble really fumbled
Yeah.
on this ad campaign, because I don't think whoever created this ad campaign understands male perpetrated violence and why women are choosing celibacy. It's not for fun, that's for sure. Yeah. So
No. It goes with the have you heard, I think it was on, like, TikTok around, like, would you rather be, like, stuck with, like, a man or a bear? And
yes,
all the women were like, "A bear,
a
please."
bear,
And the men are like, "What? What?"
because at
Like
least the bear won't say, well, what were you wearing, among other things. Yeah. Exactly. So, um, yeah, this piece in Forbes, I'm curious about it because this is like a magazine that's dominated by men, typically covers men in leadership roles. I'm seeing, I think it may have been written by a woman. Um, but when we look at sex-based differences, um, it, there is a difference in terms of who's perpetrating violence, and these things do need to be talked about. So there's just so, again, we'll do it. We'll put it on our webinar list. So let me come back to this piece here and finish summarizing. So essentially, it's saying that when a person isn't regularly experiencing the state of endorphins and stress release, then it could cause reduction in team cohesion because social bonds are weaker, increased stress levels, which will affect the team, decreased productivity, challenges in motivation, and a risk of a toxic work culture, including lower engagement, increased absenteeism, and difficulty in collaboration. So that's an interesting one. Hadn't thought of that before, but of course, all things are interconnected. So, of course, this movement whereby women are choosing not to engage so much in sexual activity, of course, it's going to have repercussions in different areas. So, yeah. Okay, last one. Towards better psychological safety in mining. So this was a piece in Australia, and for decades, the Australian mining sector has been under the scrutiny of regulators, industry experts, and the public due to the inherent physical hazards present in mining operations. And we don't normally hear of trauma-informed care associated with these types of manual labor jobs, which do have more hazards. And if there's more physical hazards, then that's going to go along with psychological, hardship as well, and increased stress. So, yeah, this conversation needs to happen. So, the demanding nature of the work, the use of heavy machinery, the exposure to hazardous substances have rightfully commanded attention to ensure worker safety. So, let's see. There's a quote here. We need to ensure the very systems and approaches applied are not placing people at further harm and disempowering them, hence building capability of the organization and leaders with training, trauma-informed practice, demonstrable psychological and cultural safety, coupled with proven health and well-being strategies and return to work processes. So it looked like these conversations were just starting to happen. They highlighted some sort of conference where it was like women who work in these fields. And so, yet again, oh, yeah, Women in Mining Summit. Yet again, we're seeing that effect of women coming in and wanting to address the psychological safety and care. And so, there it is again. So, but we love to see this in industries that we haven't seen before. So that was we got a little bit of everything today.
No, we did.
Thank you all for tuning in, and we will see you hopefully in about an hour.